Hi there. Welcome to week 6 of the Clinical and Social Services Research course. Last week we talked about treatment outcomes, and this week we're going to talk about clinical assessment and measurement scales. Before we get into this week's content, I want to briefly review with you the model of treatment outcomes that has been developed by Duane Simpson at Texas Christian University. This treatment model takes into account all of the variables that need to be attended to as we conduct research on clinical and social services interventions for people with substance use disorders. If you look at this model, in the upper left-hand quadrant, you see patient attributes. The ones that are listed are readiness for treatment and severity of substance abuse. But there are many others that we're going to talk about this week. And they're not the only variables that affect treatment outcomes. Obviously, program attributes, the staff, the climate of the setting, and the resources available to help to manage people effectively are going to play an important role. And when you combine the patient's attributes with the program attributes, you then get into what goes on during treatment. And what goes on during treatment plays an important role. Program participation is important, developing a therapeutic relationship with staff. These things are likely to produce psychological and social change, which then translate into behavior change. The behavior change that we're looking for is cessation or at least dramatic reduction in alcohol and drug use. And if that occurs, then we have favorable outcomes. But an important part of treatment that occurs after people leave a treatment program is what goes on in the post-treatment environment. And that requires social support systems and a lot of other activities which are going to maintain the gains that occurred during treatment. So patient attributes and what to measure when people come into treatment are only a small part of this puzzle, but we're going to be focusing on those attributes because they play a very large role in determining who responds to treatment and who doesn't. And we also need to attend to the variables that we measure when people come into treatment so that we can conduct proper follow-up evaluations to evaluate treatment outcomes. With that said, we're going to move on to a review of the different domains that are typically measured when people come into treatment. We call it baseline. The types of measurement, whether it's interview, questionnaire, and objective indicators. We'll talk about time windows, process measures that go on, that can be used to monitor what goes on in treatment, and a variety of other methodological things that need to be taken into account if you're going to be able to either critically evaluate the research or if you're going to design studies on your own. Finally, we'll give you some examples from major trials that have been conducted. So let's get started.